Well, the virus will inevitably, of course, put the National Health Service under severe pressure. And today, the government's effectively put British industry on a war footing, as we were hearing from Matt Hancock earlier, asking them to transform their production lines in order to produce more ventilators and tackle the virus. So, is the Health Service prepared? Joining us now is the Chair of the British Medical Association, Dr. Chaand Nagpaul. Thank you very much for being on the programme. Again, much appreciated. It's always good to get some kind of expert advice on the real situation. We were talking to the Health Secretary earlier, and he sent out this call to arms for businesses to produce more ventilators. Firms can't make too many. If you make a ventilator, we will buy it. Clearly, the NHS doesn't have enough ventilators right now.
Yeah, so our starting position, unfortunately, has been far worse than many other of our European nations. We have about a quarter of the critical care beds that Germany has, as an example. So it's really critical, it's really important that we now see transparently what plans the government has to expand that capacity. That will also, of course, be in tandem with trying to slow down the spread of the infection so that we don't see a peak that overwhelms the health service. But yes, we need to see that transparency, the plans, and exactly how we will be able to support the demands of critical care on the health service.
Why do we have so much fewer ventilators, beds than other countries?
Yeah. So the British Medical Association has been campaigning or lobbying for us to have the sort of infrastructure that many other European nations take for granted. It's a result of a decade of underfunding. And now what, therefore, we need to do is make some really decisive decisions on how that limited resource is used in the best possible way for those who are going to need it. And that may require, and it should require, actually, some major decisions, for example, on ceasing non-urgent routine care, a mass move towards many more consultations occurring remotely. We need to see the government implementing and enabling, for example, GP surgeries to provide online consultations. It's occurring in some, but it's by no means widespread. There's no need, in my view, for patients to be going into a hospital clinic now simply to be given a test result. We need to have clear plans where how patients can be remotely managed and how the technology can support that.
So do you think the whole GP system, as you like, needs to be looked at in the months ahead?
Well, yes, and one of the most immediate priorities, of course, is we don't have enough doctors. Before the outbreak, we were 10,000 doctors short. So we're very worried, and the doctors that I represent are very concerned that they don't, for example, have adequate protection. GPs have paper masks of a low effectiveness. They're worried that when they're seeing patients in their clinics at close proximity, they might get infected, and if they do, they'll be off work. The other priority for the health service must be rapid testing of doctors, because with the government's policy of self-isolation for 7 days, we may see many healthcare workers who may not have COVID-19, who may be off for 2 or 3 days, recover, and yet still be off work because of the policy. If they could be tested, they could come back to work. And I can't emphasise how serious the problem is if you've got doctors off work. In a GP surgery with 3 or 4 doctors, if 2 of them are self-isolating, that could effectively prevent the practice running in a normal fashion.
Are you effectively calling for the end of non-urgent NHS care?
I think that we have to be responsible. We know that we don't have the facilities for critical care. We need to expand those facilities. Hospitals need to now start to vacate routine facilities and convert them into intensive care beds and so forth.
What kind of thing are we talking about? We're talking about routine operations, but also if you have an illness that you know is not coronavirus or is not potentially life-threatening, that you should just stay away, effectively.
Yes, there's two ways to deal with it. One, yes, we need to make some decisions around, or the government needs to make decisions around stopping non-urgent services so that we can target our care to those that are ill and need immediate attention. But also, there are different ways of providing care. As I said, we can move to far more technology-enabled remote management of patients using video, telephone links. But also, we need to be targeting and protecting those who are the most vulnerable. So in terms of social distancing, we know that those who have got pre-existing medical conditions, those older patients who would be the illest if they were to contract the virus, those are the groups that we need to be protecting and isolating from getting infected.
On that, the Health Secretary earlier saying that they are looking at asking the over 70s to effectively self-isolate, but not yet. Do you think that needs to happen now?
I think it's important that we protect the at-risk groups now, absolutely.
So if you're over 70, you should look at self-isolating?
I think it's really important that not just those that are over 70, those that have got respiratory illnesses and those that are immunocompromised do need to be taking measures, and the government needs to have a policy for such patients to be protected.
And what kind of measures do you mean?
That means not going into crowds, not mixing with others where there may be... We know there's circulating infection, so by isolating, you are reducing the risk of contracting the virus. The other thing I also must mention, because the British Medical Association represents retired doctors, many of them are asking questions about how they can perhaps support the medical workforce. After the announcement 2 weeks ago, we've received no details. It's really important that we see exactly what is planned to enable us to have the doctor and workforce capacity to deal with this.
Are you confident in the government approach?
I think that we need information now. I don't think, we've got that information. And as I said earlier, you can't just get doctors to return back to work instantly. We need to understand how they'll be registered, how they'll be trained, exactly what they'll be doing, especially for many retired doctors who could also be in a risk group. They can provide care, but in a remote fashion, not patient-facing. So we really need those answers, plans now.
Just finally, we spoke a couple of weeks ago. You were sitting in the same place. I feel that you seem much more worried now. Your manner, your demeanour. Is that fair?
Of course I'm worried. I mean, I said 2 weeks ago that this situation could change on a daily basis. And in fact, that is exactly what has happened. We are in a very different place compared to 2 weeks ago when, in fact, when we met, we had about 20-odd cases. That is why I don't think we have the luxury of time anymore. We need to have clear, decisive plans. We need to have a very targeted approach. As I said, I represent doctors. They need to be kept healthy. They need to be protected, because if we have any reduction in our workforce, we won't be able to provide the care patients need.
Are you seeing those clear, decisive plans?
As I said, I think we need them now. We have concerns that we don't have all of those answers at the moment. We need them.
OK, thank you so much for being on the show and putting your viewpoint across. Much appreciated.
Thank you.